Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hello and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet, and I'm broadcasting from Burrowang in New South Wales, Australia, and I'm talking with Dr. Shohreh Ghasemi, who is in Iran at this point in time. But more importantly, Dr. Shohreh Ghasemi is an adjunct clinical professor at Augusta University in Georgia in the United States of America. And she's also doing postgraduate training in craniofacial trauma and reconstruction as well, along with having a master's degree in aesthetic plastic surgery. She's also about to complete a master's degree in otolaryngology and a residency in that. She's a busy dentist. She's a very busy dentist, and it's great to be able to catch up with her to hear what she's doing, what she's seeing in dentistry, and what what are her inspirations and innovations that she's seeing, that she's enjoying seeing in modern dentistry. Now, she prefers to be called Dr. Shu or Dr. Shushu, so that's what I'm going to call her. So, Dr. Shushu, welcome to the Ultimate Dental Podcast, and thank you for getting up so early in the morning your time.
Oh, thank you so much. First of all, it is my pleasure to just have good invitation from you. I know that you are super busy also with the podcast and also with Advanced My C and with lots of webinars, and it is my pleasure. Yes, right now I'm stuck in Iran because some tensions that in Middle East has happened, but hopefully everything just going to be sorted out and get back to United States as soon as possible. And thank you so much for actually your pronunciation, my affiliations, and you just like give it much more. But me as a dentist, because all the time my dream is to be oral maxilla-facial surgeon or reconstructions, facial reconstruction. That's why after finishing my dentistry, I was thinking that no, it's not done yet. You know, it needs to be much more stronger. And especially as a female in the Middle East, we don't have too many like oral maxillofacial surgeons, and even also in United States, because I'm faculty there, we have just 2 residents because I'm just from last 4 years, you know. And I said that I need to be much more stronger as a woman empowerment. Right now, also I'm coach of American Woman Surgeon, and also the Association of Women Surgeons. And I think that we need to have much more women empowerment, you know. Um, and the other thing is that in the future, I think that we need to just expand dentistry, because the dentist is just, I think that they're much more, have better approach to the head and neck anatomy, and, you know, than maybe the rest of the majors in healthcare. And I was thinking that getting advancement in technology and innovations in head and neck reconstructions is my actually favor and is my passion. And I think that in near future, everything is based on innovations, and everything should be in a personalized, personal care for each patient. That's why it's one of my favorite again is just research and also innovations and patents. Like for instance, after 2-3 years, my patent about AutoShade, that is for dentistry, that it gives you exactly the color of the teeth. And it was first was 3D, and then we just developed it with AI. It's got already published in USPTO, and we have some companies right now that they're interested to buy it, and it has got 96% accuracy, And also, I have an aesthetics show in Las Vegas, actually, just last week. I was also one of the finalists as a panelist about like face retractor that with AI. Like if you want to do any type of facelift for retraction with AI, it gives you better approach to that in which plane right now you are doing the applications, and also it gives less time for the doctor and also for the patient, and better outcome and also less complications. That's why I think that everything should be together: innovation, research, clinical skills.
Really, really important there. And I know that I was thinking, a lot of people will think oral surgeon and then facial aesthetics. They might think they don't go together, but they should. And we're seeing that not only just in that's great that it's now coming into oral surgery and facial aesthetics joining together, because I've been hearing too that even now for women with breast cancer, the surgeon who removes the lump, if they get it early enough, actually does the reconstructive surgery on the breast, so that the breast is actually put back together as one, not I'll cut it out and somebody else will put it back together. And so having both those specialties of max fax as well as facial aesthetics will mean that people will recover quicker with less disfigurement, because it's all being done at the one appointment, I guess, or at the one procedure, rather than saying, well, I've done my part, they can do their part. Is that what you're seeing in terms of bringing things together in the 21st century?
Exactly. Exactly. Because actually also I'm right now doing with the European Academy Head and Neck Oncology Fellowship. And I was thinking the same things, that the patients first of all suffer from the cancer and go to the chemotherapy and different type of like surgeries, and then after that what we should have to do. That's why we're thinking that okay, I need to just get much better information, because we have head and neck oncology, in residency, but it was not too much. And we have actually lots of like MD doctors, ENT doctors that they're just also participate, and they're just also in a postgrad program. But it gives better information for how to deal psychologically and also like physically with the patients with head and neck oncology, and how we should approach it. Because mentally they have some issues that they don't know how much is going to be the survival rates. And even also, in case everything just going very smoothly and done after 5 years or 3 years, they want to have reconstructions. And they want to have better, again, just get back to self-confidence. Maybe they're not going to have the same self-confidence that they had before, but they need to have it. We are human beings, and sense of humor.
I
We need to have it.
totally agree with you.
We need to bring back to the human beings.
You're exactly right, because as a surgeon sometimes, and even as a dentist, we disconnect from patients that they actually have feelings and thoughts and processes and doubts. And so as a surgeon, as an oncology surgeon, a head and neck oncology surgeon, they probably used to think, oh, my job's done, I've done my best on the cancer, and now let that person now get their head right and get their looks right and come back. But immediately for that patient, having the cancer out is one thing, but is the cancer going to come back is always a thought in their mind. And so if we can do the plastic reconstruction at the same time that we do the surgery, it puts their mind at ease that they're headed back to normality. Whereas if they're still waiting with scars and then have to go through reconstruction, that delay really eats into their brain as to am I going to survive this cancer? So I think that the putting of the two disciplines together is a really big thing.
Yeah, exactly. And as you mentioned, like for a woman that they already have breast cancer and just they had mastopexy, we need to have breast reconstructions as expander, that in future the patient can have, so because they, as a sense of female, they want to have something that they think that maybe they lost their like female humor or just like sense of to be as as a female. That's why reconstruction and plastic surgery can help with the expanders, and they will think that, okay, then now I'm going to have maybe not the same as before, but I'm going to have a breast. I don't look like as a man, very
Yeah. Yeah.
very slim and hot. Exactly. Also, right now from 2020, I have also one blog writing about in Medline about Zoom dysmorphia, especially about the face, because all the time, as you know, that from 2020, all the most of the cosmetic procedures, invasive and non-invasive, is already just like increase in a flash. Because especially right now, me and you, we just like look at each other in a camera and see, okay, now I can see I have some wrinkles, some lines, some this, and we have right now this Zoom dysmorphia, and the patients right now seeking to have better looking, not just over the teeth, because teeth I know that we have 32% the facial proportion is just in teeth, and and smile design, like how you do full mouth reconstruction, and the patient becomes so happy for that after that. But on the other hand, also how their eyes looks, how their under eyes looks, because it's really right now everything is just in long distance. We don't know, again, maybe the epidemic of that happens in 2020 is it coming back, and also the life patterns completely changed from 2020. We are not the same as before. We don't have that kind of like hug and kisses
Yes.
before, not traveling very easily as same as before. um that's why I think that, as I checked, especially in United States, also same as here in Iran right now, everyone's seeking and searching for new innovations, something even less invasive to have better looking.
Yeah. So, are you seeing that as a big increase? I know in Australia with isolation and the closing of borders, people weren't travelling, so
Yeah.
they decided they'd get cosmetic dentistry and cosmetic procedures done on their face. They had the holiday money went into making themselves look better. Did you see that in the US in terms of the facial
Yeah.
aesthetic side of things?
Yeah. Yeah. Exactly. It just like, I don't know, I just like increase in a flash. Even also I saw lots of patients, like before we said, if you want to do any kind of neurotoxins like Botox or any type of neurotoxins, it's better to do after 25. But I saw lots of my patients are just coming, they're 22, 23, and they say, you know what, Dr. Shu, we have some wrinkles, over here. Can you do baby Botox for me? I said, baby Botox? You know? And also lots of like cosmetic, like even also rhinoplasty, like no surgery or lip augmentation, shear augmentation. And social media is also one of the things that everybody wants to look, especially with that type of Snapchat and filters. They want a good look, even also in the real, not just with the
Yeah,
filter.
exactly. Now, I was going to mention this later, but you've brought it in now. You're a very big influencer on social media. You've got a very big following on Instagram. How did you build that up, and
Yeah.
what do you do to maintain it and keep building it?
Yeah, actually, I started in, I think it was in 2014, 15. I started my Instagram, it was very like very regular, mostly with the pictures or travel pictures. But after that, I keep starting to just give some information, you know. And because I have some patients before, like more than maybe 3,000 patients, 4,000 patients in Iran, and I just leave Iran and get to United States, still my Iranian followers still just follow me, and they want to have much more updated information that what is going on in United States. That's why my followers is just keep increasing, because most of the time, sometimes I'm just coming with live. I'm talking about everything, not just about teeth or dentistry. Sometimes about how to get into dentistry program, or also last month I was talking about Monjaro, that it was a new, actually semi-glotted um, pharmaceutical. It just comes up right now in the last 2 years for losing weight. And lots of Iranian, they keep like DM me, and I don't have any person to just answer, and I mostly answered them, And they said, "Can you just talk about it? Does it have any side effect?" And I said, "Yeah, definitely. I would just talk about, because I saw in my patients that how they just lost fat, and they just they don't have appetite. It just helped them with HbA1c. With and that medication's already FDA approved. And I keep just coming up with new things, and even they ask me, especially in DM me, "Can you just talk about this? Can you just take, like, Endolif is right pop in the United States? Which cream or skincare you just recommended?" And I think that social media really educate and share lots of valuable information. But also, on the other hand, I saw some of the influencer and bloggers that they are not a doctor, they're not a healthcare provider, and they give some false or myth information.
Yeah, really, really, really important there for our dentist viewers of this podcast to realize that your success as an influencer is about being interesting and not just ramming dentistry down their throat. So I was hoping you weren't going to say, "Here's me walking through a surgery, and look at this, we put this person's jaw back, and this person, we put their eye back," and things like that. And it was just about dentistry. But, like you said, it was about travel, it was about diet, it was about weight loss, it was about things that people, you attract people because you have a broad knowledge and a good knowledge of a number of topics. And I think that's the important thing with social media, that when dental practices even just start with a Facebook account, all it is buy our tooth whitening. We've got free cleans or something, and there's no differentiation. What they really want to know is, what's the recipe of the week, and what's Jenny, the receptionist, going to be doing on the weekend. She's got her hockey final, or Julie, the dental assistant, went out to the movies with her grandchildren, or took them bowling. Things like that. That they're actually human beings, and that's what you get from a lot of Instagram influencers, is that there's a broad range of things there. It's not just the same selfie pose all the time. So good
Yeah,
work.
yeah, exactly. And yeah, and then I think that it's better for us as a healthcare providers, or as a doctor, physicians, dentists, that maybe also we have much more better impact on people, because we have much more scientific information that we can just provide to the people, to our followers, and they can just go exactly through the data, because I saw lots of like people that they got lots of profit from influencing, or just like advertising, and then that's wrong, that's completely wrong.
Yeah. It's nice to show that you're unbiased and you're independent, and also that it's not. Oh, by the way, buy my toothpaste every time you do a video. So that's really, really important. Tell me, the residency that you're just about to finish in otolaryngology.
It's already finished. Yeah, both together. I just did it both together at the same time.
Explain to our
It was
explain to our
actually
viewers what
very.
otolaryngology is.
Yes, it's same as actually is rhinology, same as ENT doctors, because in oral maxillofacial surgery, they keep saying that it's better, especially also in United States, that do not do too much rhinoplasty. But lots of like people asking about what we can do, um like they have sleep apnea, and then also we find out there's a kind of like deviation in symptoms that give them the apnea to that. And I was thinking that, okay, sure, you know what? And also I'm writing a book about rhinoplasty, but preservation rhinoplasty, minimally invasive rhinoplasty. And so that I need to just have also masters in rhinology, that in case, because we have sometimes barriers between ENT. I love them so much, but when we just invited as a coming for the conferences, they said that no, we are not, because you are not specialized in rhinoplasty. That's why I was thinking that, okay, sure, you know what, you need to go for some kind of like masters. That was online program, and to get that type of like much more update about rhinology. And I started with that, and it should be finished for myself. I just put a goal, and last year was one of my awful year, and I was just in a thunderstorm in my 40, and I said, and that was really helped me, because when I was wants to think about negative things in my life, with like losing my sister, and I have some also complications in Iran that happened to me. The only things that just cut my negative thoughts is just get back to the models and then study. And I did these two together um, at the same time, but it was just 1 month difference, and I just finished it, and I got the
Wow,
degree.
that hats off to you, because I know when I was studying, I needed to have nothing in my head whatsoever. So, with all those distractions going on in your brain, and still being able to focus on improving your education and doing those master's degrees, that's a big achievement. A very big,
Yeah, thank
yeah.
you. Yeah, because yeah, I was thinking the only things that also can maybe just cheers to my sister, because she all the time wants to see my achievements, and I was thinking that no, Shushu, because of her, you need to just get back. And then I said, okay, especially about my book that I'm the senior editor, and I have two ENT doctors in that book as the editor. I said that Shushu, you need to be also updated same as them. And I started, and I said I need to finish it in a year, and it's happened.
Let's look to the future. Where uh,
Hmm.
where do you see yourself in 5 years' time, or is that a question that you don't really know? You just, because you've, are you driven in one direction and this is just where you're going to go, or do you think I'll go this far and then there may be other doors open? How do you see the next 5 years?
Um, Actually, the academic and to be a researcher, as I told you, is all the time is in my top priority. Right now also I'm going to be the ambassador of AMS, is like aesthetic multidisciplinary conferences. We are maybe five doctors, and I'm only the oral maxilla-facial surgeons. Most of them, they are ENT plastic surgeons and the facial cosmetic surgeons. We are five right now, and I'm going to be in October. Hopefully, if everything just goes so smoothly, in November I will be speaker in China for AMWC. Um, I think that my life still is dedicated to be a researcher, to be a faculty, and also be a innovators. And in last 2023, 2024, I was much more focusing AI, 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 and I see, and couple of weeks ago also I saw, and I just posted also in social media that, oh my God, AI is right now going to be as a dentist. That's why we need to be keep up with the new things, with new innovations. Like, for instance, we don't have before navigation in surgery, and right now we have navigation with AI and AVR. That's why we need to be most of the time updated. My priority is to be all the time to be in a academic field, to be as a researcher, faculty, and as I told you, I'm right now a candidate for dean for health science in Georgia Tech. Um, and then after that, also I need to be a speaker, not just to just give speech, also to learn from people. We need to be all the time just coordinate ourselves in everything. Because also when I'm just attending the conference as a speaker, I learn lots of things. I learn lots of information from different speakers. I said, "Oh my God, yeah, we can do this for that. We can do this for, and we can get lots of like information and exchange, and also not just exchanging the information. Also, sometimes you just get some hints and nice or personality from different people.
Yeah, there's the,
Like for instance, if you know that my um, my pattern in my life is Dr. Joe Nyamto. He's the best actually oral maxillofacial surgeon, and he's doing maxillofacial surgery for 4 years. And after he did in 1984-5 when I was born, he did the first facelift. All the doctors, plastic surgeons, and ENT doctors, they want to starting. They just fight against him, and he just brought 80 articles that maxillofacial surgeons can do in a court. He just brought all 80 articles that can do facial cosmetic surgeon. And all the time, I just keep listening to him, to his YouTube channels, and I love him so much. And he's like, he's my hints, and he gives lots of hints to me. And I think that I can be the same as a woman, because I saw, I don't want to say discrimination, but I saw, but thinking that maybe that discrimination is just in some maybe Middle Eastern countries. But I really just saw it in United States, that like they said that my chief, that I love him so much, he said she should know we couldn't have women too much in maxillofacial field because it's very rough and tough. And I said no, we need to. And exactly in 2022, in August, when I just get enrolled as a faculty, I said that we need to have two women, and he accepted. That's why we can have right now, especially even also with social media, we can have better impact on each other.
Yeah, really, really, really important.
This is my plan.
Yeah, I think so. So you're championing for more women to be more in more responsible roles in academia and get a more even distribution of women in faculties and teaching.
Yes, yes, yes. That's why right now, I don't know. I just get I'm just coach for Association of Women Surgeons, and also they just written to me that there was two suicide happened last month about two Colombian residents of surgery in Atlanta, and they just asked me about it. That what is going on. And when I just get back, because I know in which university happened, hopefully it was not in us, but I know which university was it. And I'm just going to get some much more data, and we need to stop it. We are right now in 2024, and everything has changed. We need to also change. We need to bring much more freedom and just stop any type of discrimination, not just in ethnicity, in everything, culture, religious,
Yeah,
everything. We need to have innovations.
yeah,
Yeah.
how true. We've got to be more tolerant of people who are different from us, and see the good
Yeah.
in what they bring. Very, very important. Um, you do a lot of travel, education, family. Uh, how do you beat jet lag?
It just happened to me actually. I just get back from Canada because my parents, because my mom especially, she was not in a good medical issues. She has got medical issues, and I told her, okay, we go back to Tehran, and then I just get back to United States, and I'm just right now 8 days. I'm completely jet lag, and I need to get back also to United States as soon as possible when the borders are opened or when the flights started to again just get back. Maybe sometimes with some supplements like melatonin or just meditation, listening to some podcast. It just helped me to make my just relieve my negative thoughts and just relax myself. And that's it, the only things. Yeah, I just traveled like from April. I just, because I was also speaker for AOCMF in Prague, and I just reached to Doha because I want to see my parents in Tehran. And again, we have the tension between Israel and Iran, and I stopped more than 2 days in Doha, and I was the leader of 200 Iranian passengers. And finally, we just get to Tehran, and then also there was an international conference of implantology in China, and I was in China for 8 days. And you know that the Chinese people are just like very fast, you know. And but the good things from that, it was first impression from me for the from China, and I had a very negative like impression from them, but they were nice, and I saw the innovations. They are really struggling in life, you know. And I was in the 5 cities, and from Beijing started, and then I was thinking that it's really I think they learn lots of things from them.
Yeah,
You know, like I can see they just like they're really innovators and technology. I saw very nice, beautiful facilities of healthcare departments in dentistry. Oh my god, it was like incredible. They have the same CAD cam of Sirona, and they copy that the same as that. First of all, that one is 100K. This is actually 10,000 USD, and it was even much better and much more accurate compared to Sirona, you
mm,
know. And yeah, and it was so amazing. I can even also share some pictures to you. It was really, really, really amazing. I think it is in my social media. It was so good. And then right now I'm going back to again United States. I'm going to be in a actually surgery conference. I'm in SAS 2024 in New Orleans, and then after that for AMWC right now. Um, I'm going to be in October, Baku first in Azerbaijan about talking about preservation rhinoplasty, and then after that, 8 days after, I need to go to China.
my goodness.
Yeah, I keep yeah. But my parents they told me, Shushu, you need to stop because this is also gives you aging, and I'm sure that you don't like to age too much. But it gives much more ambitious to me, you know, to see different culture, different people, you know, and I like cultural exchange, you know.
Yeah, really, 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 really important to get out and see the world, and you're certainly doing that. 8 days in China. Tell me the Chinese innovation and the fact, and I'm seeing this a lot in the work that I'm doing with Advanced My CE in terms of products. The Chinese are able to make cone beams and printers now at fractions of the cost of what the Americans are being charged, which is I think the first companies are charging what they want, and then the later companies are now working out there's a big margin that doesn't need to be put onto the dentists, and we can get these products
Exactly.
out much quicker. Cone beams for a third of the price of what some of the big companies are charging. And like you said, the facilities and the products are world class. It's just a myth that's been, I guess, promoted in dentistry that well, let's see how much we can charge until the next competitor comes along. And I think ultimately the consumer pays
Yeah,
there.
they're so. First of all, I saw that a lot of the patients because I went to different clinics, you know, and also that they have a hospital in implantology. Very nice hospital just in implantology. It was beautiful. Everything is so white, neat, clean, and it was like very innovative. Is I was thinking there was I'm just in a everything so 3D, you know, and and I was like super shocked, you know. And even they have I told you they have the same like CAD cams from Sirona from and it was even much better than
Hmm.
that. And even they just put it as a to just compare. And I was actually speaker for implant from Biodental, and I was said, oh my god, like from the Biodental or from the Stroman, from all those or Noble Biocare, they have those type of like abutment fixture everything, but they also create build it the same titanium alloy, same even much better as a Stroman or Nova Biocare, and they just compare it. I said, okay, I don't have anything to say, and much cheaper.
Hmm. Well, that ultimately,
1 out of 10.
yeah, the consumer's going to win if that's going to drive prices down for dentists because the dentists don't have to pass those high prices on if they're not being charged them themselves. That'll make dentistry more affordable to the public, and I think that can only be a good thing because that's a big thing that stops people going to the dentist is just the cost of what everything costs these days.
Yeah, yeah, yeah. And it was, I think that doing implant with prosthesis is, I went to the clinic and I just checked with them, it's like $350. That's it.
Do you see?
And in United States, it's 2000.
That's crazy. In your specialty, do
Yeah.
you see that as now becoming something that more and more dentists are wanting to become? Is that a specialty that's growing in terms of oral surgery and also cosmetic surgery? Do you see those as growing parts of the industry?
Yes. I think, yeah, oral surgery is one of the, is tough, is really tough, and also in different countries, it has different curriculum. Yeah, like in European country, we have oral surgery that it's 2 or 3 years. That 2 years is much more implantology. 3 years, they have a little bit oral path. Um, in oral and maxillofacial surgery in European countries, there should be MD and then DDS, and then after that, 5 years residency in oral maxillofacial surgery. In United States, it's 4 years or 6 years. 6 years is MD and DDS and OMFS. But mostly right now, the students or the residents, they want to just go for 4 years program because they want to get back to the to just starting to work, then they can just like pay their installments of the loan, and but oral maxillofacial surgery is one of the toughest because you need to dedicate somehow your life, but I think there is a new major is coming very soon, in most of the actually, I'm sure it just come very soon in most of the universities, in AI in dentistry and AI in healthcare. I saw we have some courses, but we don't have master and PhD. There is in Rochester Tech right now, I think that they have PhD in AI in healthcare, but in next maybe 1 or 2 years, AI is just coming, or AI can be also one of the curriculum or added as a modules to dentistry and also to different specialty.
How do you see AI changing dentistry? How do you
Yes.
see, where do you see AI will take dentistry from what it is now to something different? What will it be? Will we have robots doing?
I think still the performer is the dentist, you know, but AI just like facilitate and with better outcomes, like same as surgical guide in implantology, that gives better, to you to how to put it, how to insert it, how many millimeters you have distance between the adjacent, teeth, but same as that, AI can facilitate the dentist and performer to just have better accuracy in your treatment plan also. I think it couldn't be the dentist, AI, but it can help.
Yeah, I saw at
It can help.
I think I saw it at Sydney Dental trade exhibition in March, AI and diagnosis, and we all know that if you had one patient when saw 20 dentists, they'd get 20 different treatment plans, and so now with AI, it can standardize that and take away a lot of the doubt for patients. Well, all right, it's AI generated, it must be what I need, as opposed to, well, he said this, he said 5 fillings, she said 7 fillings, that doctor said 9 fillings. Which one is it? Well, now AI says 7, so it must be 7. And I think that's anything that gets people going to the dentist, because anybody who gets 5, 7, and 9, guess how many they get? They get none because they're so confused. They say, oh, I'll just wait and see, and then everything gets worse. And so if we've got AI to create more certainty for the patients, then that patient will proceed with their treatment and get it done, and that's ultimately removing pathology from their mouths, and that's a good thing. So, and it also, as you said, the AI in helping the oral surgeons doing their treatment and helping them to know exactly where to cut and exactly where to drill on their way to accessing what they need to access will mean less injury, because smaller sites, and that's got to
Exactly.
be a good thing for those patients as well.
Yes, less time, less morbidity, less
Mm,
dehiscence, and also better outcomes, for patients, and also easier and much more facilitate for doctor or for dentists to do any type of like kind of like surgery or any type of like dental um, things, fillings and the whatever. But yeah, I think AI is going to be somehow it gives better accuracy, and maybe it can be much more reliable for the patients, because right now again with the social media you will see lots of like before and after of full mouth reconstructions or even also cosmetic things, but maybe with the AI patient can rely better to that doctor.
mm, mm. Dr. Shushu, you've got a very interesting history in dentistry, and you've also got a very interesting future in dentistry from what you've told us today. I really thank you for taking the time to join us on this podcast and share your observations and also your expectations of your dental career, how it's been and where it's going. And one thing that you didn't mention, but I do know, is that didn't Forbes magazine vote you as one of the top 10 oral surgeons in the world? Is that correct?
Yes, 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 actually it was in 2022. Yes. An entrepreneur magazine. I was in the top 10. Yes, yes, yes. And I was the only Iranian. We have Italian, Turkish, American. Yeah, I was one of the top 10. Yeah.
Congratulations.
And also my book about innovative perspective also in the Forbes is, and also in CNN. It was also one of the top 10, and it's right now. Actually, it was before from I know as I don't know from 2023, but in lots of universities it becomes references.
Oh, excellent. So viewers can find the details of Dr. Shushu's book and also where to contact Dr. Shushu in the podcast notes after this broadcast. Dr. Shushu, just tell us what's the best way for people to contact you? What's your email address and your Instagram handle?
Yeah, they can. Sure. My email address that mostly I can just be in contact, with in all around the world, because my domain university doesn't work
Oh,
in some
yes.
countries. But yes, yes, because we need to have push notification. We do, and from United States, that's why it doesn't work. Like for instance, in Iran. But like Shushu, SHOOSHOO underscore G as a girl and H as a horse at yahoo.com is my email address. My also LinkedIn is same as Shohreh Ghasemi. If they can search it, just pop up. And also my Instagram is dr dot again Shohreh SHOHREHGHASEMI. They can just be in contact with me most of the time, like in less than 10 hours. I'm just like reply back if they just send me a direct message, or if email me. Definitely I will do, in case I'm just like in a flight or I just stuck in somewhere that I don't have the internet. But I'm just like answer in all the direct messages and also my emails.
Well,
If you have any questions, if any of our listeners they want to just participate in any type of research, they're welcome. Because I'm writing again two more books. One of them, The Office Space, is already done. The books will be published very soon. It was actually going to be one of the references in facial cosmetic, but is really very updated with really nice authors. And also, I'm going to have much more book about one rhinoplasty, and also I'm going to have one about trauma in maxilla-facial surgery. And I'm very, very, very happy and delighted if anyone as a researcher, dentist, oral surgeons, prosthodontist, periodontist, they can just like um, just be in touch with me and just join in our research group. And hopefully we are going to also launch, as you know, Dr. David, new program of fellowship program in implantology that's going to be accredited with your actually CE, and also with another associations. Very soon we are going to launch it, and in Oman is going to be, and in case if someone from GCC from Gulf countries, they can just be in touch if they want to just know about the fellowship in implantology that is accredited by Ministry of Health in Gulf countries.
Oh, wow. Do you ever
Yeah.
sleep? Do you ever? You seem like
No,
you do so much work.
no.
You're always.
Unfortunately, no. You can see that how my eyes right now is puffy. No, I have insomnia because we just finalized the modules. Like I will share it to you very soon, and then we just have actually talking with the Ministry of Health in Oman and also the Gulf countries, and we need your help also for getting some accreditations, and we will start it very soon in October.
Oh, wonderful. Well, Dr. Shushu, thank you very much for being on the Ultimate Dental podcast. It's been a pleasure talking with you, and I look forward to catching up with you.
Thank you. It is my pleasure. Thank you for your time, for your dedication. Thank you. You just like struggling also. You are same as me, even much more, you know. You struggling a lot and you keep updating all the people, dentists and also all over the world, from all over the world. I know.
Well, thank you very much. I look forward to talking to you soon. Thanks very much.
Sure. Thank you so much. Thank you. Bye-bye.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.